Hello and welcome to Awaiting a Liver Transplant, What to Expect. My name is Lorraine Stiehl, and I'm the Chief Executive Officer of the American Liver Foundation. I'm also a caregiver to my husband, Chris, who is a transplant recipient. We are so excited to be partnering with UPMC, the University of Pittsburgh Medical Center, to bring you this highly anticipated webinar to help liver patients navigate the often complex transplant process. Our experts will discuss what to expect during the liver transplant evaluation process, how you can prepare for your upcoming liver transplant, and what resources and support services are available for patients, caregivers, and family members. At the end of our presentation, our experts will answer questions. So please be sure to insert your questions in the Q&A box in the chat. We'll get to as many questions as we can later in the program. Now let's begin. Please join me in welcoming our two expert speakers, Dr. Scott Biggins, Chief of Hepatology and Director of UPMC's Center for Liver Care and Medical Director of UPMC's Liver Transplant Program, and Tammy Rothacher, a registered nurse, clinical transplant coordinator at UPMC's Liver Transplant Program. Tammy, your role is so vital to the transplant process and helping patients prepare. Would you mind kicking us off?
Be happy to join you today. Thank you so much for this invitation. Well, as you personally know, going through a transplant is a lot to undergo. And so here at UPMC, one of the big things that we take great pride in is trying to do a thorough job of educating people what it means to go through a liver transplant. Initially, when you get that diagnosis, hearing that you need to possibly have a liver transplant, that can be very frightening for a lot of people. So we want to take a little bit of a fear out of that process by giving you some things that you can actually do now to prepare once your doctor has decided that a liver transplant evaluation is right for you. There are some things that you can do to get ready for your upcoming evaluation. An evaluation is something that typically is ordered by your current doctor who is managing your liver care. That could be your local GI doctor or a hepatologist if you're lucky to have one of those in your area. Once they refer you for liver transplant, there are some things that you can do once you find out that that is indeed the next step. Some of the things that you can do ahead of time include a cancer screening, speaking to your insurance company, seeing a dentist, and making sure that you're up to date with all of your recommended vaccinations. Something in regards to cancer screenings. So this is going to be something very vital. It's important for all of us, we know, to undergo routine cancer screenings. But if you're considering undergoing a transplant, after transplant, you will need to take medications for the rest of your life that suppress or lower your immune system. This in and of itself is a reason that you need to make sure that there's no underlying cancer somewhere that we're not currently aware of. A colonoscopy for everyone who's 45 years or older, a mammogram for women who are age 40 or older, and a pap smear for any female under the age of 65 should be done every 3 years. You actually can't be listed for transplant without these, so please talk to your primary care doctor now about getting these very important screenings completed today. Another thing that you can do while preparing for your evaluation is to call your insurance company. Making sure that you are with an in-network transplant center is going to be very important. You also want to see what transplant centers are closest to you locally, as going through transplant means lifelong follow-up and care. So being closer to home will obviously be a better option for you. You also want to ask when you're on with your insurance company any questions regarding your policy and transplant benefits. Some transplant companies also offer travel and lodging benefits as well. This would be particularly important if you're not able to go to a transplant center closest to home. And then that was going to require frequent follow-up visits and maybe stays close to the transplant center. So these are all things that you can do now to make sure that you understand what benefits you're entitled to with your current insurance plan. The next thing you can do is make sure that you see your dentist. A lot of folks I know have fears of the dentist or just haven't been very good at following up with their dentist regularly. If you decide to move forward with transplant, this is going to be very important. You're going to want to make sure that you keep up with 6 months cleanings, and any dental procedures that need to be done will need to be done prior to transplant. So if there's any cavities, any teeth that need removed, these are all things that you should schedule for and plan accordingly to have those taken care of before your evaluation if possible, but definitely before your listing. The other thing you want to consider is vaccinations. These are something that are going to be really important because, again, as mentioned previously, if you move forward with a transplant, you're going to need to be on medications that will lower your immune response. So ideally, what we would like to do is have you immunized prior to transplantation so that you have the best opportunity to achieve immunity to any preventable diseases before you will go down the road of transplant. Okay, now for everybody's not so favorite subjects, diet, nutrition, and physical fitness. I know, not everybody likes to talk about these things, but this is something that you have control over. So much in this process may have caught you off guard and may have made you feel really like you're not in control anymore. And we don't want you to feel that way. We want you to know that there are things you can do even now as you prepare to increase your outcome after a transplant. Here at UPMC, we have you meet with a dietitian and we have you meet with a physical therapist. But even if the center you go to doesn't offer those things, having a good sense of nutrition and also increasing your physical activity are key factors in ensuring that you have the best outcome possible. So what are some things that you could do to improve your diet even today? Believe it or not, what they say is true. Small changes do have big impact. So for instance, you want to think about sometimes with liver disease, you don't really feel hungry or you feel full a lot of the times. And it's really easy for all of us to grab that quick snack. But that may not be the best option. So you really need to consider what you're consuming on a daily basis. You want to focus on eating small, frequent, high protein meals that are also low in sodium. You'll want to become a label reader. If you think about it, anything that you eat, when you consume it, looks closest to how it came out of the ground, then you're probably on the right track. For example, a baked potato would be a better option than those French fries. Maybe not as tasty initially, but definitely will reap big dividends in the end if you kind of think about it that way and make those better choices. Anything regarding vegetables, if it's fresh or if it's frozen, is going to be better than anything out of a can. Anything that has been canned is typically going to have a lot of salt in it. So again, become a label reader. Okay, now for the other one, exercise. I know, hard to find time in everyone's day to do exercise. But the reality is, again, small changes can make big benefits. So if you're a couch potato currently, let's start to change that. Let's try to get up and move around. If you already have a good fitness routine in place, let's just say you walk every day, maybe try to do a little bit more tomorrow. Again, small changes, doesn't have to be huge, but what can you be doing to work on your weak spots? Are your legs weak? Are your arms weak? Do you have difficulty climbing stairs? These are all basic everyday activities that you can do. And whatever you did today, try to do a little bit more tomorrow. This is definitely going to help to prepare you for a transplant. Studies have proven that people who go through a transplant, it's often comparable to runners, the effects on their body when they run a marathon. Nobody jumps off their couch and just goes to run a marathon. So same thing, you've got to think about this. You're in training now, getting ready to go through a big surgery. And it's really not rocket science. You just want to be as strong and healthy as possible so that when your time comes for the surgery, you're as prepared as possible. And that's going to lead to better outcomes on the other side. Other important considerations for transplant. Do you currently smoke? This is often a difficult habit for a lot of folks to break. But the reality is that if you want to move forward with transplant, you cannot smoke, vape, chew, or rub nicotine. You need to stop those. This is really difficult for a lot of folks, so I would encourage you to call your primary care doctor, see what help they can provide. You can do patches, you can do gum, and there's oftentimes some medication that doctors can prescribe to help you with this as well. But you want to begin this process now. A lot of folks think they're going to wait and see what the outcome of the evaluation is, but really, that's stinking thinking. You'll want to start now. This is something you can control and that will lead to better outcomes on the other side. The other thing is alcohol. You cannot consume alcohol and move forward with a liver transplant. You also cannot consume recreational drugs. So if these are any things that you're currently engaging in, you're going to want to get engaged locally with an addiction counselor. And you can do that pretty simply by calling the back of your insurance card. They'll let you know areas that are close to home, that are in network with your plan, and you can get engaged with someone. This is going to be a program requirement, particularly if your liver disease was alcohol related. So again, starting this process sooner rather than later will only help to get you to transplant faster. Do you have diabetes? If you do have diabetes, you want to make sure that it's under tight control. If you don't currently follow with an endocrinologist and your diabetes is not under good control, this is an appointment you want to get scheduled. Oftentimes it takes a little while to get in with a specialist. So again, starting that process now will save you time later. If your primary care doctor is currently managing your diabetes, you definitely want to make sure that they're aware that you're considering a liver transplant evaluation. This has to do a lot with the medications, again, that you must take after transplant. They oftentimes can raise your blood sugar, so you want to make sure that it's under tight control before you consider transplantation. Another key piece to undergoing a transplant is having a confirmed caregiver and a driver. Sometimes this is the same person, but other times it isn't. And that's okay, but you would need both to be considered for transplant. The reason being is that a transplant is a lot to undergo, and you're going to need someone that's going to be able to provide 24/7 care for you in the post-operative phase. So for about 6 weeks after transplant, you're going to need someone that is willing and able to assist you with medications, how to take them, when to take them, and some of them can't be taken together, so they'll need to be up on that and be able to help support you through that. Now, eventually, you'll be able to take on these duties yourself, but right after transplant, you're not going to be on your A game. So having a really good caregiver that is willing to come alongside and support you through this process is very important. The driving piece here in Pittsburgh is a big thing. Some people, they have a caregiver, but not everybody's comfortable driving in a big city. If that's the case, that's okay. It can be two separate parties, but you would need both. Another thing that you want to make sure that you do is to keep up to date with the list of your current medications and medical history. When you actually come in for the evaluation, you'll meet with a pharmacist and they'll review your medications with you. But having an up-to-date list of what medications you take, what dosage they are, and how often you take them is going to be very important for the team caring for you for transplant. You'll also want to have written down your medical history, any surgeries or procedures that you've undergone, the dates that you did them, and where they were done. Sometimes we're able to see those medical records, but in the event that we can't, we may need to request them from the center for which they were done at. So having that list up to date and current will just help make the transition smooth and easy when we need to request things on your behalf. Okay, so just as a little wrap up, top 5 things that you can do today to be more prepared for this evaluation is number 1, call your insurance company. You want to find out the nearest in-network transplant center and what benefits your plan has regarding transplant. The second thing you want to do is get up to date on all routine cancer screenings and immunizations. The third thing you want to do is stop using alcohol, tobacco, or any drugs and get engaged in counseling locally. The fourth thing you can do is work on improving your diet and physical function. Remember, small changes make big difference in the long haul. And number 5, talk to family and friends about what you're going through and begin those discussions regarding the caregiver role and expectations. These are all things that you can do as you prepare to undergo a liver transplant evaluation. Everybody here is rooting for you and wants you to have the most successful outcome. Thank you. And now I'd like to introduce to you Dr. Scott Biggins, the medical director here of liver transplantation at UPMC. Dr. Biggins.
Well, thank you very much, Tammy, and thanks to the organizers for putting this together. I'm very excited to bring the next phase here of talking about what the transplant process is once you get here. So there are 3 simple steps. We will talk a little bit about meeting your team, specializing in getting your physical exam done and your testing done, and then the transplant committee meeting. So once you get to the medical center for your liver transplant evaluation, you'll meet a wonderful nurse coordinator like Tammy, you've already met earlier in this presentation, who will be your primary point of contact throughout the whole process. So you'll have someone who's there, who's the air traffic controller, who will help you through the whole process. You'll also meet a transplant hepatologist, someone like myself, who specializes in liver care. You'll meet several other folks, including a transplant surgeon, and the surgeon is the one who's actually going to be doing the surgery on you, so important to bring all those questions that you might have about the surgery itself and the specific recovery afterwards. Most centers, including ours, will have a social worker that will meet with you. They'll talk about financial concerns, social circumstances, substance use, and look at the whole you from a mental health perspective as well. You'll meet with a dietitian and you'll hear about the nutritional needs that you have. They'll be important while you're going through the transplant evaluation. And for sure, while you're on the transplant list, you heard quite a bit about sodium and finding those good nutrition labels and learning about how to have the right diet for you before transplant and also after transplant. And those will be very different because after transplant, you're going to want to focus on really having a lot of protein and making sure your muscles and your body can heal after the transplant. So listening to your dietitian will be very important. Most centers will have other members that you'll encounter too, including a financial counselor, a pharmacist, a psychiatrist, and an anesthesia doctor or a cardiologist. And the pro tip I'll point out to you is that you really want to have your care partner with you for all this, so you have an extra set of ears and eyes and even a notepad to write some of the stuff down as you go along, because there'll be plenty of questions that you have. You also get physical testing, so you want to be prepared for that. Come dressed well so that you're ready to have a physical exam, because the overall health beyond your liver disease is going to be very important to the evaluation. So you'll get some blood tests that will look at the health of your liver, but also your other organs. You'll likely get some imaging tests, an ultrasound, a CAT scan, maybe an MRI. You might get some pictures of your lungs or breathing tests or other tests to look at the health of those other lungs as your other organs as you're heading into a big operation. You'll get heart testing, so this will almost certainly be an echocardiogram of your heart and maybe a stress test to see that all the blood is getting to your heart and it's healthy enough to undergo a big surgery like that. You heard a lot from Tammy already about getting cancer screens. So if you haven't been able to get that before your evaluation, you'll need to get that after your evaluation before a transplant. So try and get going on that early, but don't worry, we'll get to it after the evaluation if we need to catch up on that. Dental health, very important. You heard about that from Tammy also. So it's good to get that going as soon as you know you're headed in this direction for an evaluation, because you'll want to have seen your dentist and getting any teeth pulled or gum issues taken care of ahead of time. And then be prepared that you'll likely get some drug testing for alcohol and recreational substances. So those are important just to be aware you're going to get testing for that. And the pro tip here, I'd say, is ask which tests you need to be fasting for. So some of those tests, like the ultrasounds or the stress tests, you might need to be on an empty stomach, and you don't want to have a full lunch and then not be able to get that exam. That will slow down the process for you. So the next step is the committee meeting. Importantly, you don't need to be present for that. So this is your doctors, your surgeons, anesthesiologists, the nurses, the pharmacists, the social worker, everybody that had the opportunity to meet you will get together and have a team discussion. This is something that is looked at sometimes in a process of what kind of things do I as a patient need to prepare for this, but it's mainly just get all your testing done as soon as you can, and then the transplant team will get together and have their team discussion. The outcome of that discussion is can be a fewfold. One, accepted for transplant, and then you'll hear from the coordinators, and they'll move forward with financial approval and get you placed on the transplant list. A second option that may happen is that you'll need to get some more testing, or you'll be asked to follow up with your counselor. So basically deferred pending that you get that extra testing done. And on occasion, after looking at the risks and benefits of the liver transplant surgery for you, you may hear that you were declined as a transplant candidate. And that can be a heavy weight on you. Important that you keep in contact with your hepatologist or gastroenterologist and your whole healthcare team so you can keep your health as high quality as you can. And don't forget that you do have an option to seek another opinion from a transplant center. Now, thinking ahead, what are the goals after a liver transplant? So, you want to find that mountain that you're going to climb up, whether it's getting down to the grocery store or out to the soccer game with your kids. Find the mountain that's important for you and recognize that that's your goal. You're going to want to work with your healthcare team to recover from your surgery. There's going to be a lot of work there. Generally, early on after a liver transplant, you're seeing the surgeons and the nurses twice a week for the first few weeks, and then that extends to weekly, and then the goal would be to get you come maybe every few months. And then most of the time we get people on a routine where they're seeing us yearly in the clinic. You want to maintain good nutrition and a healthy lifestyle. So if you were smoking before and you quit for your transplant, you definitely want to work to not go back to that and really focus on that nutrition and all those notes that you had from your dietitian. You want to know and make sure you're taking all your medications, and there can be a intimidating list early after transplant, but recognize that list of medicines will start to peel back as the further out you get from transplant. You want to expect that you're going to be getting regular blood tests to look for the health of the liver, to assess for the medicine levels that you have for the anti-rejection medicines, and likely be getting some periodic pictures of the liver, either by an ultrasound or a CAT scan. You want to keep up to date on your cancer screening and your vaccines after transplant so you don't get any new health issues that could have been avoided otherwise. And you want to stay in close contact with your healthcare team, both your primary healthcare team, but also your transplant nurse coordinator. And you can see how passionate and engaged and strong of an advocate that Tammy is, and work with that coordinator that you've made the contact with over your journey to transplant. And finally, I just wanted to land on a couple helpful resources. Say if you just Google UNOS liver transplant, you'll find quite a bit of extra information there. UNOS is the United Network for Organ Sharing that is a contractor that helps organize a lot of the transplant process, but they also have a lot of good information that you can get. And they have a specific website called UNOS Transplant Living. The website is showed there, and there's a drop-down piece for before transplant, after transplant, living donation, some advice on costs and communities, and different frequent asked questions. The UNOS.org transplant site has some larger scope questions about what it's like to get involved in advocacy for you or your family or other support groups. So it's also something to consider. And then on the UPMC website, we also have a lot of resources there for the deceased donor program and our live donor program and our transplant oncology program, and also connections with just information and facts about transplant. So I hope you've had some of your questions answered, but I'm more than happy to take more questions from the audience here. Thanks for your attention. Really appreciate everybody organizing this event.
Well, thank you very much, Dr. Biggins, and thank you to Tammy. These presentations were incredibly insightful, and I hope it empowered all of you at home. It brought back lots of memories when my husband had been transplanted. I do understand the issues of good health and how important it is. And my gosh, I still have such great fondness for our transplant team and what they meant to us. So again, thank you, Dr. Biggins and Tammy. So now I'd like to open it up for questions and answers. And I have quite a few questions, I believe. So let me take a look here in Q&A and in the chat. So delighted that we have these questions. Okay, the first one, let's see. I think this may be a good question for Tammy. How much support will I need after my transplant, and what should I plan not to do afterwards?
Okay, well, very good question. First of all, I want to preface it by saying that, of course, everybody's transplant journey varies from person to person. So how well you recover often depends on how sick you were before the transplant. But with that said, as a rule of thumb, typically you can expect to be restricted in activities, so you're not able to work, you're not able to drive, you're not able to lift anything heavier than, say, a gallon of milk for about the first 12 weeks after a transplant. And that's, again, just a basic rule of thumb. So you're going to need that caregiver during that time, again, to get you to and from those appointments. Ultimately, when you want to restore you to a great state of health. And so as you slowly recover and are able to do more, we strongly encourage you to do more. Take more ownership over your health care, take more ownership over your medication regime. So again, as you recover and are able to do so, we want you to do that well.
Terrific, Tammy. One other question I think is perfect for you. How many times would I need to be reevaluated while on the transplant wait list?
Okay, so again, that's going to vary from person to person. Typically here, that's driven a lot by something called the MELD score. MELD stands for Model for End-Stage Liver Disease. And based on what that MELD score is for you, will determine how frequently we need you to come back to the transplant center, see the hepatologist, update that MELD score, and that will vary again from person to person based on whatever that number may be. Your waitlist coordinator will certainly update you accordingly. They'll assist in scheduling those appointments, and they'll mail you strips in the mail whenever you do need to update the blood work.
Thank you, Tammy. Now, it looks like this question may be good for Dr. Biggins. What happens if my liver disease worsens while waiting for a transplant?
Yeah, I'd say that, unfortunately that's going to happen for many people. So you want to keep in contact with your local providers and certainly let your transplant hepatologist who's managing you and your care know about things getting worse. As your liver disease progresses, your priority for transplant may increase. So this MELD score that you heard about is a function of how sick the liver is. So if your liver is getting sicker, that MELD score likely is going to rise and your priority for transplant may also go up. So if you're getting sicker, you're having worsening of your overall health, important to engage your transplant team, but also your local team. Let them know how you're doing. If you're developing extra fluid in the belly and the legs, if you're starting to get confused, if you're starting to have bleeding, either vomiting of blood or pooping of blood, very important to just call 911 and get to the ER, and then work on getting your, yourself transferred to the transplant center, and maybe it's even your time for transplant now.
Good information. Another question in the chat for, I think, Dr. Biggins. What are the options for transplant for someone who's an alcoholic?
Yeah, so, we recognize that alcohol liver disease often comes hand in hand with alcohol use disorder, and it's really important to get both treated. If you have alcohol use disorder and you can't get your alcohol liver disease fixed, then that's trouble, but it's just as much trouble to fix the alcohol liver disease and not pay attention to the alcohol use disorder. So many transplant centers will ask that you're engaged in both behavioral health and counseling, and consider even medications to help with cravings, but really want you to get to a place where an alcohol use disorder is controlled and you have long-term sobriety. Many transplant centers may consider transplanting someone who has acute alcohol hepatitis, so a short period of sobriety. And it's important that you work with the transplant centers to make sure that they are caring for the whole you. So both the alcohol liver disease and the alcohol use disorder, so that you get all the help you need to have a long, healthy life after a liver transplant. And it's healthy and avoiding the alcohol lifelong. If there is a return to alcohol use after a liver transplant, it's important to be upfront and honest with your team because there are services that are there to help you. It's less of a, we got you. It's more of, how can we help you?
Okay, very good. All right. Again, Dr. Biggins, this may be a question best for yourself. I'm 61 years old and want to know what exactly I might need, when I might need a liver transplant, and when I do, will I even qualify?
Yeah, well, I think what you may be getting at is, at 61, is there an upper limit of age for a liver transplant? And I'd say it's important to think about, it's not the age, it's the mileage that you put on your body. So, how's your heart? How's your lung? How's your overall fitness? Have you been able to keep your nutrition up that you heard about? Have you been able to keep your strength? Are you able to walk? So these are really important things to think about. So there are many people that are older than 61 that can be excellent candidates for liver transplant, but we really need to ensure that the overall health of your body, your heart, your lungs, your strength are all ready for a big surgery like that.
Okay. I remember that well, actually. My husband was probably the healthiest he had been in a while going into the surgery. He wanted to do everything in his power to be healthy, which helped a lot. Okay, is there a way I can increase my odds of getting on the transplant list sooner? And I guess that's you, Dr. Biggins, if you'll answer that question.
Yeah, so I think, being prepared when you go to the evaluation, like you heard earlier in this discussion about, getting your cancer screening done, getting your vaccinations, trying to be organized and prepared for that evaluation, that can really expedite the process of getting you on the list and getting you ready for a liver transplant. In terms of increasing the odds, there are two ways that we can really get access to a liver transplant. One is with what's called a deceased donor transplant, and that's where this MELD score is really important. So as your body gets sicker, the MELD score generally goes up and your priority for transplant goes up. The other means to get a liver transplant is through a live donor. And a live donor is where someone who is alive donates a portion of their liver to you, and that portion that you get will regrow to a full liver in about 2 months, and the portion that is left over in the live donor will regrow in about 2 months. When a live donor is available for you, generally someone it doesn't have to be a family member, but someone that has a personal connection to you, there is not that long wait for that liver disease to progress and the MELD score to go up, and that very anxious waiting period for if or when you're going to get a deceased donor. So in terms of having the highest odds to get your liver transplant, if you're able to find a live donor, it's going to be much more likely that you're going to be able to proceed quickly to a liver transplant.
Thank you very much, Dr. Biggins. And I think this is a question for Tammy as a transplant coordinator. What type of at-home items do I need post-surgery? Boy, do I remember these. Shower chairs, grab bars, phone lists, et cetera, et cetera. Tammy, will you answer that question for us?
Absolutely. So again, this is going to vary person to person based on how sick you were before transplant. Again, the goal is to restore you to a high level of health. And so if you needed any of those items, obviously before transplant, the reality is you may still afterwards. But just because you had a transplant doesn't necessarily mean that you're going to be debilitated for very long. actually, right after the transplant, the goal is going to be to get you up and get you moving as soon as possible. So if you do feel like you need any of those assistive devices, before you leave the hospital, you'll have the opportunity to meet with a discharge planner. And at that time, they can assess those needs and order anything that you might need from a home care perspective. For a lot of folks, the showering will happen, but you'll have to be careful initially because of the incision and drains and things that you'll be dealing with. But showers are allowed, baths are not. So, honestly, if you're able to stand in the shower, that's great. If you do feel like you need a shower chair, again, that's something that can be addressed prior to your discharge. Before you go home, you and your caregiver will go through an education class, and they're going to review all of this information with you. And here at UPMC, we provide everyone with a book. And basically, I like to refer to it as the post-transplant user manual. How do I navigate this new liver? When do I need to call in and ask questions? What should I be concerned with? And so whatever information from whatever center you utilize, please make sure to review and read that information, as it's going to contain a lot of those are very important things: phone numbers to call, who to contact, and when to call someone.
Thank you, Tammy. I remember our user manual was huge, but boy, it was our lifeline. It had such great information, and I sure appreciated social workers and home health care and all. Lots of great resources out there. So, thanks for laying that out for those watching. Okay, and Tammy, it sounds like maybe this is another question for you. Is it possible to be listed for transplant with a MELD of 16?
So yes, as Dr. Biggins mentioned, there are two different pathways to liver transplant. And ultimately, during that selection committee meeting, as we discussed earlier, the team is going to look at everything comprehensively, and they're going to make a determination on your need for transplant. Although the MELD score often dictates the availability of those deceased organ offers, having a living donor option allows folks who really do have an indication for transplant get there faster than just sitting on that wait list waiting for a deceased organ offer to become available. So here at UPMC, we really do advocate for living donation, and we try to provide patients and families with the resources to initiate that process so that there's hope for folks who maybe still really need this life-saving operation, but aren't really going to be high enough of a MELD score to receive necessarily the deceased organ offers right away.
Thank you, Tammy. And we too at the American Liver Foundation are passionate about living donation, and need to continue to promote that in a big way. Okay, Dr. Biggins, how about this question being directed to you? My cousin lives in Nevada, but the wait to receive a transplant there is very long. If he moves to live with me in Vermont, could it shorten his wait time?
Yeah, again, I'll go back to this this concept of a live donor. So if a live donor is available in Nevada or on the West Coast, then you still don't have to have that waiting time for your liver to get sicker, for your body to get sicker. So then it doesn't make that much of a difference. There are different supply demand ratios across the country for the deceased donor, meaning that balance of patients who need a liver versus patients or people who are dying and becoming deceased donor. And that can vary from state to state, from geography to geography. And there are areas in the US that have a higher supply than others. And on the West Coast in particularly, but also on the East Coast, on the borders, on those very populated areas, the supply-demand ratios are a little less in your favor. So it is okay to consider going to another center. It is for sure not illegal. It's for sure not something that you can't do. One of the big challenges is whether or not your insurance would cover an evaluation at a second center. But if you have that question, you should not feel like you can't ask your doctors and your coordinators about that. And for sure, you can also contact UNOS and ask them for any questions there, because they are for sure an impartial advisor in that process too.
Very good. I know our situation. We were looking at a couple of other states, and but then fortunately we had a living donor present themselves, so we were able to stay in our state. Okay. All right. This sounds like a question that might address some autoimmunity issues in liver. If my body is attacking my liver and bile ducts, causing the need for liver transplant, wouldn't my body eventually attack the new liver too? And if so, would liver transplant even be an option for me?
Well, I'll take that one if it's okay with you, Tammy.
Yes,
So
absolutely.
yeah, I think this is a very important and sophisticated question, right? So if you get a liver transplant for autoimmune hepatitis or primary biliary cholangitis or primary biliary sclerosing cholangitis, then, will that come back after a liver transplant? And the answer is maybe. So a lot of the conditions that can cause cirrhosis or a need for a liver transplant can recur. But that generally doesn't exclude you from proceeding with a liver transplant. We would pay attention to that after a liver transplant, look at your laboratory tests, look at your imaging to determine if there's any concern for recurrence of any condition, but in this case, the autoimmune conditions. And it may be that we need to do a liver biopsy to determine if there is any evidence of that autoimmune disease coming back. That's the same approach that we would have if we were concerned for rejection of the liver. And so it's a pretty standard approach to doing this. The medicines that we use to prevent rejection, many of those can also prevent the recurrence of some of the types of autoimmune conditions like autoimmune hepatitis. There are others, autoimmune conditions like PSC, this primary sclerosing cholangitis, or PBC, where the anti-rejection medicines don't really modify that much, but there are medicines that we could use separate that would target that.
Hey. Here's another question for you, Dr. Biggins. Does MASH improve or go away with a new liver?
Yeah, similar question theme here. So the MASH, or metabolic associated steatohepatitis, or fatty liver disease, can reoccur after a liver transplant. As many of you may know, as people get larger, they have more belly fat, they have more prone to having diabetes, high blood pressure, high cholesterol, and those are some of the drivers for developing MASH in the first place. And after a liver transplant, you might have more energy to get out and be more active. You'll certainly have more education on the diet, but you'll also be on medicines that sometimes can make it harder for the diabetes to be controlled, or high blood pressure or high cholesterol to be controlled. And so if you're predisposed genetically or by these medical problems to have a metabolic associated steatohepatitis before transplant, it can happen after transplant. The timeline for that occurring usually is many years, sometimes decades. And the treatments are very similar, really, to control the diabetes, the high blood pressure, high cholesterol, and to have a low carbohydrate diet and get out there and exercise. And generally recommend that, of course, as tolerated, but a target of 150 minutes of moderate exercise. So that's exercise that gets you sweating. It's not walking, it's it's running, jogging, swimming, those kind of things. And that can pull fat out of the liver and reduce the likelihood that you'll get inflammation from fat in the liver that would lead to scarring and injury of your new liver.
Okay, one last, it looks like we have two questions to go, and one for Dr. Biggins, but then also the last one for Tammy. So Dr. Biggins, is post-transplant itching common?
Yeah, so I'd say I'll start with saying that pre-transplant itching is pretty common. And a lot of times after the liver transplant, that will get better. But it is possible to be there. The challenge that can happen really depends on how the new liver that you get is working. So if there's blockage of the bile ducts, then you for sure can get some buildup of the bile acids in the skin, and that can lead to itching. Many times that can be relieved by unplugging the bile ducts with procedures like an ERCP or putting stents or balloon to open up any blockages there. Sometimes there can be a recurrence of the underlying disease that caused the need for a liver transplant that can come back and lead to some itching. So the short answer is yes, but it's less common after transplant than before.
Okay, and thank you. And Tammy, final question, something I hadn't thought of. Do I need to give up nicotine gum in order to qualify for transplant?
Okay, so this one is probably center specific. Obviously, nicotine isn't necessarily something that we need. We would want to encourage you here to stop completely. We would encourage nicotine gum as a means of tapering down your need for the nicotine. I do not think here, and Dr. Biggins, correct me if I'm wrong, I do not think that that would prohibit you from actually being listed, but we would still strongly encourage you to work towards the goal of complete cessation.
Yeah. So yeah, I would just add on, the really dangerous part about nicotine is generally how you're taking it, right? So it's very good to avoid it and get off of it, but what we really don't want you doing is smoking and inhaling it and or chewing that tobacco. So a gum or a patch is much safer than those other alternatives that can lead to infections of the lungs, infections elsewhere, increase your risk for cancer of the mouth, the jaw, or the lung, or elsewhere in the body. So nicotine gum or patch is definitely better than smoking or chewing tobacco. But of course, getting all the way off of all nicotine and being nicotine free is the ideal goal.
Okay, well, thank you so much, Dr. Biggins and Tammy. Boy, I know I actually learned some things, even though I've been through the transplant process in the past with my husband. So thank you so much. I hope this is valuable for all who tuned in, and thank you all who submitted questions in the chat. So we've reached the end of our time together today. Everyone who registered today will receive a follow-up email with a recording of this program and a list of resources and support services outlined throughout the presentation. So if you have any questions about the University of Pittsburgh Medical Center, UPMC, please visit their website at www.upmc.com/transplant. And if you have more questions about liver disease, American Liver Foundation is here to help. Call our free helpline at 1-800-GO-LIVER or visit liverfoundation.org to view our robust library of educational resources and support services for patients and caregivers, including our Living Donor Liver Transplant Center, a National Transplant Center Finder, and free monthly virtual support groups moderated by a licensed clinical social worker. And research is important. You can also help change the face of liver disease research by registering for the American Liver Foundation's patient registry, the first ever patient registry for all types of liver disease, created to help provide researchers with a better understanding of liver diseases, the impact of current treatments, and how liver disease affects patients. So please check out patientregistry.liverfoundation.org for our patient registry. Again, thank you, Dr. Biggins. Thank you, Tammy. And thank you to all of you for joining us today.